Okay, doctor. We know that before planning to get pregnant, obviously you are practicing some form of birth control. And what is familiar to me is the birth control pill. Now there has been talk about time that you should be off the pill for a considerable length of time before trying to conceive. Notions being that if you're not off of it long enough, you can have a child that might be born with a birth defect. Can you shed some light on that, or do you think it is important to be off the pill, or what can you share with us concerning the birth control pill?
Okay, the pill is a hormonal method of preventing pregnancy, and there are other hormonal methods. And so the injection, you might have heard about the injection, which is a preparation of either a single hormone or a combination of hormones, which is given to women either monthly or every 3 months. That's also a popular method because it takes away the responsibility and having to remember to take a pill every day. Other hormonal methods include the intrauterine device, which is also impregnated with a hormone, and that's called Mirena. And many women have seen those ads on television and are sort of, asking more for that sort of birth control now. One of the advantages of the Mirena method is that, again, there's very, very little user involvement. Once the IUD is placed into the uterus, basically that user has to check once a month after a monthly cycle to make sure that she can feel the strings of the IUD in place. Her doctor needs to check her once a year. So very little sort of user involvement. She doesn't have to remember to take something every day. So those 3 methods that I mentioned are hormonal methods. Now, there is another IUD which does not contain hormones, which is another type of birth control where a device is placed inside of the uterus. It's called an intrauterine device as well. And there are others. The barrier methods still exist, and using the condom is a barrier method. That the barrier just means that it's preventing contact between sperm and the egg. And those are still, quite popular today.
Touched on birth control.
Right.
And you've also managed to touch on the different topics that we would be discussing further in the program. Mm-hmm. However, it's all about creating the family and a better family life.
Right.
So we're not so much looking at the prevention of becoming pregnant, because we are looking forward to creating a family.
Okay.
So how soon, or I should say, is there a particular time limit that the mother who wants, or the woman who wants to become pregnant should be off the birth control pill? Do they give like a specific time, or you can decide today I'm off the pill and tomorrow try to conceive? And is there a possibility that you would conceive?
Yes, yes, and yes. So, and remember that the pill is just one method of birth control. So essentially, maybe I can look at it from a slightly different viewpoint. We expect someone who has been contracepting or preventing a pregnancy to become pregnant within a year after stopping that contraceptive. So,
so within a year.
Right.
So it can happen before?
It can happen before a year. It can happen in the next cycle. In someone who's taking the pill, if she stops the pill this month, she can get pregnant in the next cycle. That's possible.
What about, because I've heard in the past that there are possibilities of the child being born with a deformity if you're not at least a year off of the pill.
That's not scientifically proven. It is a myth today.
Okay, we started off the program by talking about prenatal care.
Right.
And you mentioned that it is important for a family to plan a pregnancy.
Right.
Could you tell us a little bit more about that? Why do you think it is that important for a couple to plan a pregnancy?
Well, because I think that a couple needs to be ready in several different ways. They need to be ready emotionally, they need to be ready mentally, they should be ready in terms of their physical maturity. And that, as you know, can differ from person to person. They may want to be ready financially. And nowadays, because economic times are becoming a bit difficult, it is important to be sure that you can afford what you need to be able to afford in order to raise this child. And remembering it's not just a baby that you're raising a child who's going to want to be an adult. And all of the different ramifications of that. There's feeding the child, there's caring for the child, there's providing for the child when you cannot be there. There's, education and so on. And so one would expect that when a couple decides that they're going to have a child, that they will say, okay, well, it's going to take 9 months at least for this child before the child comes here. Where are we going to be in 9 months? We're going to have to be paying close attention to this child after he or she is born for at least the next maybe 10 years. What do we think is going to be happening to us in the next 10 years? How is our life going to go? What are we planning to do about our lives that's going to be able to nurture a child in the current environment? And those are questions that if people think about them before they actually decide that they're going to have a child, then maybe that first pregnancy is going to be delayed a little bit. But then when that pregnancy comes, it's going to happen in an environment where the child can be nurtured in the way it should be nurtured in order to make sure that it will grow up into a successful and productive adult.
Okay, so we've covered the pre-pregnancy in terms of health. Mm-hmm. We've covered the birth control issue, and now you can say we're ready.
All right.
We're pregnant. What kind of, or before the pregnancy, mm-hmm. and we talked about checkups.
Yes.
What kind of checkup would one need? Because you mentioned earlier that both male and female should be physically fit or right. should be ready. Mm-hmm. So what kind of checkups would you say would be necessary?
Okay. I think the male and female would like to be sure that they are free of any chronic diseases. I mentioned that earlier, and the chronic ones would be diabetes and high blood pressure. They would probably want to have themselves checked for sexually transmitted infections. The female should certainly have a pap smear test, which is a screening test for cancer of the cervix. That is part of a normal health checkup. They should be screened for other problems like thyroid disorders. The thyroid is a gland in the neck that produces hormones that helps with our metabolism mm-hmm. and growth.
Why?
Because if there's a dysfunction of the thyroid, that would affect either the woman's ability to become pregnant or could adversely affect her pregnancy. So if it is found, it needs to be dealt with. And sometimes there may be no obvious symptoms. So there's a screening test that can be done to check for that. Okay, so the thyroid test can be done on the blood. But actually, before the blood test is done, the couple, or male and female, should have a physical examination done by a doctor. Now, we are assuming that these are two healthy people and that we're not necessarily going to find any problems. We don't expect to have to do actual fertility testing on this couple until and unless they have been trying to conceive and they have not conceived. And usually the time period is about a year of unprotected sexual intercourse. If the couple has not become pregnant in that time, then investigation would be done to check on their fertility. So the physical examination would be that we would be expecting to find normalcy in the various systems of the body. And in the case of the male, you know, we'd expect that we'd see the normal male characteristics and normal heart and so on. And in the case of the female, we would, in addition to the general physical examination, an internal examination to check on her pelvic organs to just determine the direction and size of her uterus, which can sometimes have an implication in pregnancy.
You were talking about uterus. Now, I've heard about do they call it an inverted uterus when it's turned backwards?
I love to hear people say inverted uterus.
So what is the correct term, and does that have any ramifications for pregnancy whatsoever?
Let's first of all correct the term.
Okay.
Because if you think about the word inversion, whenever I hear the word inversion, I think about a balloon. And if you think about a balloon that is blown up, and if you push your finger inside of the top of the balloon and you push it out through the opening of the balloon, that is inversion. Okay? So our uterus is shaped like a pear. And if the uterus is inverted, then it suggests to me that maybe something is coming down from the top and coming out this way. So it's not inversion. The normal position of the uterus is called anteversion. Okay, and it's tilted. The uterus is tilted forward like this. All right. The bladder sits in front, and the uterus tilts over the bladder like this. The term that you're looking for is retroversion, where the uterus is actually tilted backwards. So if I were to show it to you like this, and so that the viewers can understand it a little bit better, if the urinary bladder is in front of the uterus like this, the uterus is sort of curled over the bladder this way in anteversion, and in retroversion it is tilted back like that. Okay? And the significance of that is that usually in pregnancy it corrects itself.
Okay.
It may remain in that position until a certain stage, usually about 10 to 12 weeks, and then when it actually needs to get out of the pelvis and rise into the abdomen, it does just that. It corrects the retroversion. And
so no real ramifications for
very, very rarely you can have a problem where it gets stuck behind there, but that is very, very unusual. So no worries about inversion of the uterus.
And you were mentioning about you had started with the male and female getting the checkups,
right,
and that you are hoping that they're both healthy,
right,
and expecting positive results.
Right. So, and we might want to, at that initial stage, if there's a couple who really comes and presents themselves for examination to know whether or not they're healthy enough to be pregnant, we're not doing fertility testing now. We're just doing sort of screening tests. In addition to the physical examination, then there are probably certain blood tests that one might want to do before one gets pregnant. We would want to know what a blood count is like, that is the level of hemoglobin, or whether the person's anemic or not. That goes for both male and female. We might want to know what their blood groups are for both male and female, because sometimes there could be problems regarding blood groups in pregnancy. We would certainly want to know what their sickle cell status is, because that also has ramifications for pregnancy or for the child. And then the other things that I had mentioned before are, checking things like the blood sugar, the thyroid screen, and just generally the liver function and the kidney function that can be tested in the blood, and sexually transmitted infections that would be important to check for as well in the blood.
Thank you for watching A Better Place. I invite you back next week for part 2 of the topic pre-pregnancy. I'm Angelique Martis Ramon. Do have a blessed week.